Hello, and thank you to the United Democratic Women for holding this space to talk about abortion access and restriction challenges across our country. My name is Carin Chase, and I've been active in Washington state politics my entire life, from marching as a kid with my mom in war protests to working on education as a school board member and healthcare and human rights issues as our county human rights commissioner, as president of the Washington Federation of Democratic Women, and most recently, I was elected as a board member of the Seattle chapter of the National Organization for Women. In Washington state, we are fortunate that if you want or need to end your pregnancy, you have the legal right to have an abortion. It doesn't matter if you're a minor, an adult, married, gender nonconforming, an immigrant, incarcerated, or differently abled. Everyone in Washington state has the right to choose to stay pregnant or to have an abortion. So how did this all become a law? Well, in 1991, activists rallied behind a law protecting abortion access in Washington called Initiative 120. And their goal was to limit the reach of attacks on Roe v. Wade in an abortion hostile political climate marked by Reagan-era influence and the rise of evangelical voters. Abortion rights activist Marcy Bloom in 1991 was the director of Aradia Women's Health Clinic and the board president of NARAL Pro-Choice Washington. She said that in blue states like ours, we realized we can't really depend on the feds. You just never know. We saw the power of the right wing. We saw the power of the Catholic Church and the evangelicals. They weren't a political force until the Reagan years. And so Initiative 120 evolved, and as she put it, into our own statewide Roe v. Wade. So in 1991, Initiative 120 was passed by a vote of the people and declared that a woman has a right to choose a physician-performed abortion before fetal viability. But Initiative 120 did more than legalize abortion at the state level. It included an economic equality provision to ensure that women could access the procedure regardless of cost. This is the reason that Washington allocates state Medicaid funding for abortion, a rare deviation in a country where the federal Hyde Amendment restricts the use of public dollars for most abortion care. Each state gets to decide how it uses its Medicaid funding, so part of it was making sure that economic issues could not be a barrier to women to make this choice. And this is critical because women of privilege, women of means, women of wealth can access safe abortions because they can go to another state, they can go to another country, and poor women and girls can't. Washington further expanded access to abortion through the legislature's passage of the Reproductive Parity Act, which mandates that insurance companies that cover maternity care services also cover abortion. So here in Washington state, we must also thank Senator Patty Murray and Senator Maria Cantwell as steadfast advocates here and across the nation. And like the majority of Americans, they understand that these are decisions that belong between a patient and a provider, not politicians. And as we recognize the anniversary of Roe versus Wade, we must be clear that access to abortion is at risk like never before. Dr. Denise Bayusik, the Chief Medical Officer for Planned Parenthood of Greater Washington and Idaho, anticipates the number of out-of-state patients to dramatically increase if Roe v. Wade is overturned. In Eastern Washington, the Spokane area, right now between 30 to 40% of abortion appointments are for Idaho patients. The Idaho governor signed a law that could ban abortion at about 6 weeks, which is before most people even know they're pregnant. And this makes Idaho one of the 26 trigger states where abortion would essentially be illegal 30 days after the Supreme Court overturns Roe, if that comes to pass. And we know that patients will not come just from Idaho, but from across the country. The Guttmaker Institute has estimated that if Roe's overturned, demand for abortion in Washington state could increase by 385%. That's right, 385%. But at Planned Parenthood, they're not backing down. They were going strong during the pandemic and have expanded abortion services by expanding sites and adding the options of a patient being able to access medication abortion without having to come in person. Dr. Bayusik calls this an all hands on deck moment and won't stop fighting just because there's obstacles. So we know here in Washington, constant vigilance is vital at all levels. In the state legislature, there are a few bills in motion that are related to access. We have one where we're affirming Washington State's Abortion Act. And this bill clarifies unclear language in existing laws and ensures that high quality professionals provide safe abortion care, and affirms that abortion care is accessible and available to all, regardless of gender identity, and commits to the ethical concept that healthcare decisions should be between medical professionals and patients, not the state. We also have a Keep Our Care Act related to healthcare entity mergers. And because mergers between healthcare entities like hospitals and clinics are prolific in Washington state, and under current regulations, these mergers have negatively impacted cost, quality, and access to necessary healthcare services, which in turn exacerbates our systemic inequities for rural and low-income communities, people of color, women, and LGBTQ+ individuals. And right now, these consolidations receive minimum oversight, but the Keep Our Care Act would change that, ensure that all health entity mergers and acquisitions would improve, not harm, community access to care. So in Washington, we're not backing down. This is an urgent moment for abortion rights, which are under attack. We believe that all people deserve access to healthcare without barriers or political roadblocks. We should all have the freedom and power to control our own bodies and our own lives. Abortion is healthcare, and access to abortion is essential. Thank you all for the work you're doing every day for people across this country. You're making such a tremendous difference and highlighting the important values that we're trying to protect to ensure that individuals can make their own healthcare choices based on their personal decisions. Thank you so much.